So nobody wants to go right before lunch, so I'm going to try to be as fast as Shikenya was. You set a bar, Shikenya. I am, and I'm also going to skip through a few of the things, and their rack cards are going to be put on your table so that you can look at a little bit of what we're doing. Our focus for the last 7 years has been early intervention and prevention, and trying to figure out how we, and Shikenya touched on this, do this in community, because it absolutely takes a village. When I came into this, one of the things that I was seeing is so much blame between parents to schools, schools to parents. Everybody's doing something wrong, and we need to change that. It's not helping our kids, and our youth need us in their corner working together to be successful. And how do I change this? Am I doing something wrong here? Am I using the right one? Oh, there we go. So we started off as a collaborative. We convene 60 partners, which includes our behavioral wellness partners. It includes our school districts throughout Santa Barbara County. It includes law enforcement, our hospitals, with the goal of working together to figure out how we create collective impact. Shikenya referred to this as well. It's around systems change. We can't keep putting Band-Aids on the problems. We've got to design what's going to work best for our community, determining the funding that's needed, and then creating those programs. So that's a goal of the collaborative working together. We also started a couple years ago with Santa Barbara County Education Office and Santa Barbara County Behavioral Wellness hosting the Youth Linkages Network. Some of the staff that I see the most maxed out are school counselors, our resource navigators, our family advocates who are on the front lines answering the call and yet having nowhere to direct families. So they are trying to hold space for families. And so the goal of this Youth Linkages Network is to do as much education on the resources we have in the community, and especially focusing on our buffering services as well, so that we can make responsible referrals and make sure that we are ensuring closing the loop so that people are accessing those resources. Often in our community, it's been easy to just refer to the same sort of 4 big organizations everybody knows about, but that doesn't always benefit the family. We also have started a youth advisory board. It was touched on that I did something called the Wellness Connection for 5 years in our South County schools. Well, now we're going fast. The Wellness Connection is focused on the youth advisory board that we're starting in collaboration with the Santa Barbara Behavioral Wellness is going to bring together 1 to 3 students from every school, public and private, throughout our county, with the goal of educating students around mental health, showing them how to do advocacy, giving them the option to start clubs on their campuses and provide campaigns on their campuses, and providing them a lot of support in understanding what's going on in our community beyond just their schools. One of the things that we're excited about with this is the fact that there will be kids from throughout the entire county coming together. I'm going to skip this and move on to resources. So in our work, what we started realizing where we could benefit our partners is doing more of the backbone work to support the work that everybody else is doing. So our partners are doing the direct service, we're doing the behind the scenes. So we look at the resource directory as a way to make it easier for counselors and family advocates to find information. So we have over 200 organizations stemming from wellness to crisis, and in the nonprofit sector and the private sector. We need our private therapists, we need our treatment programs as much as we need our nonprofit programs. And often schools can't make referrals to anyone in the private sector. So this is the way that the schools have been able to make referrals to the directory to widen the options that are available. We also have a community calendar where we try to list everything that is relevant that people can sign up for in the moment. So every support group that's going on throughout the county, educational opportunities, anything that we can tie families into, with the idea being that a counselor can be sitting there with a parent, pull it up and say, you have Tuesdays at noon, let's see what's available. The RAT cards have been a big thing that we did 2 years ago, and these are what I hope got put onto everybody's tables. These have come out of a lot of conversations over the last 7 years, listening to parents, listening to schools, and figuring out how do we do, again, more education around this. So one of these cards is simply all of our support helplines in our county. More importantly, How do you make those calls? After working for a lot of students, becoming the trusted adult, I had 4 students call me from their colleges a couple of years ago, concerned about a friend of theirs in Santa Barbara who was over 18 who was suicidal. They had all the tools, they had been taught how to make the call, what to do, but now they're out of town and he's over 18 and it's more challenging. Going through that process of 5 hours on a call, being on our different local hotlines, and seeing again where we have barriers and fragmentation, I sat down with some of our partners on this to talk about how do we make sure that we are giving families the language to make the calls. We tell parents to make calls if they're concerned. We tell youth to make calls if they're concerned, but then they get shut down. Your friend's over 18. It's private. You can't do this. You can't do that. There are so many things we can do, and we need to make sure that we're educating people. We also need to make sure that we are checking all of these hotline numbers and making sure they work. So when we have our different helplines that take 20 minutes to get through to, we need to let parents know it's not that they don't care. There's staffing shortages in our community. Stay on the line. They want to help you. But really important that when we are doing this work, we're calling these numbers ahead of time, seeing what that experience is like for a parent or a young person before they have to make it. The other reason, so we made these RAC cards 2 years ago. This year, there's legislation at the state level that all schools need to be posting resource information as well as self-care information and how to, and coping skills. So we were asked to put these together. So again, there's continuity throughout our county. So encouraging people where the resources, how do you talk, encouraging people to talk to someone, and how do you manage your self-care? Working with other collaborators and listening to a psychiatrist, and again, sensitivity to families, who was saying, oh, these parents, they just think they get more time with a psychiatrist. They don't get it. They don't get it. When parents have to go into managing a mental health challenge with their family and they do not have this background, it is absolutely overwhelming. And when their child is being put on medication for the first time and they have 15 minutes with that psychiatrist, so again, how do we educate them on the different roles that exist out there and encourage them to build a village with a therapist, with their pediatrician, so they're getting the support. The coordinated care one is what to do after a crisis. What do you do when someone's leaving the emergency room after a suicide attempt? Often families leave there without any support. Working with some of the schools like Santa Barbara Unified and learning from the counselors there that parents are being sent out. They sometimes don't let the schools know for several weeks. So the schools are behind in being able to give them the support. There's so much shame and stigma we know that comes with a suicide attempt. So this is around giving people information, giving parents the information they need to go through, again, to encourage them to build a village, to encourage them to ask for help and reach out. One of the things I was told with this one is, oh, that's a lot of information on there, Rachel. Can we just make it a little less? These are not fluff pieces. These are what parents need, and these are what youth need. And so the goal with this is it may take them weeks to go through this checklist, but it's what they need in terms of supporting them to get through it. And so we're trying to give them really solid information. These last few are just fun ones to open up conversations for teachers with students, with parents with students, and do more listening and less talking. And then a fun one that we love to do, which is great for classrooms, it's great for around the dinner table, is teaching youth to label their emotions, modeling it as parents, modeling it as teachers, so just 1 or 2 things for how we're feeling. One of the things that we do when we're working with students talking about this is you don't have to share your whole story. You can just give a couple of words that will open it enough for someone to know where you're at. And if I'm a facilitator or a teacher, it gives me an opportunity to read the room and see where everybody's at that's in the room today. So I really encourage this, and it's been really neat to watch students actually check in with other students just based on some of the words that have been shared and say, I don't need you to tell me everything, but it sounds like you're having a rough time and I just want to see how I can support you. And then this is just the ABCs of self-care with ideas on how to do more in terms of positive coping skills, and then one on unplugging and finding balance with our devices. So those are the different cards. They're all available. We've modified some of these for other communities. So for those of you that are not in Santa Barbara County, we're happy to help with that too. We also just recently launched support groups, working again in partnership with a lot of our organizations and learning that since the pandemic, many organizations have not had the capacity to continue to provide support groups. Support groups to me are hugely significant. When we talk about meeting tier 1 needs, when we talk about prevention, the more that we can connect youth and families to others who are going through something similar, give them the place to be able to talk, get resources, learn from each other, can make such a difference. So we've been launching these support groups that anybody in the county can access. We will be launching in the January those that are in Spanish-speaking groups. And then we recently have launched one called Teach Well for teachers. We've had teachers reaching out just saying, I've been teaching for 20 years and it's never looked like this in my classroom before, and I need support on how to connect with my teens. So that's also available. We have a tips page on YouthWell with lots of different information on how to navigate, and that's actually this page, how to navigate mental health challenges. We also have put on workshops quarterly that are virtual, and we have a whole library now of recordings that are great for parents and youth to watch. I've also had teachers who have shown them in their classrooms and then use it as a discussion tool afterwards. And then we work with Family Service Agency to offer youth mental health first aid and QPR training. The QPR training has been added because mental health first aid training is a fabulous program, but a lot of schools are challenged with that 8 hours to get it done. So QPR can be done in 1.5 hours to 2 hours. And then this is something we're hoping to have the schools take over, but in the spring, we put together a very comprehensive list of all the volunteer opportunities in Santa Barbara County. We know that when we volunteer, it can absolutely benefit our mental health. We also know that so many students right now feel so much pressure to perform, and volunteering becomes a checklist item for their college applications and for graduation. So we put on a workshop every year, and we invite a lot of our different nonprofits to come and speak, not just about their nonprofit, but about what volunteering in that sector looks like. And we really talk to students about how important it is to find something meaningful and why, and that you build skills, that you connect with something you love. Don't just volunteer where your friends are volunteering. Go do things that mean something to you. I can't stress enough how important it is that all of our schools have up-to-date current volunteer opportunities. When we give kids lists with acronyms, they don't understand what they mean, and so they're being put in places where sometimes they're just stuffing envelopes and they have no connection with what the experience is. And then we have lots of positive messaging we're doing on social media as well. This is another thing we're trying to work with a lot of our schools on. I have a lot of interns that work with me, and they've been going and visiting all the school websites over the last year, and parents and youth typically are going to go on their school's website first when they try to find information. During the pandemic, so many of our schools, so many of our organizations were doing everything they could to keep up that information, to keep people linked to services, but it's a lot of work to keep it up. So we've been working with County Education Office, who has said they will take on that charge. And what we're asking all of our school districts to do is to have accountability, to have your school website resource page current with what's on your campus, not the community, because it doesn't help if we put 1 or 2 organizations on there, but what's available, what clubs are available, what mental health resources are available, again, covering the gamut of wellness to crisis. And that's it. So thank you so much for having me. And if I can get resources to anybody, I'm happy to, and have a great lunch.